there's a very good chance that I can support you. Back pain is the #1 cause of work-related disability around the world, but it's also estimated that like 80% of people will have major back problems in their lifetime. And a small percentage of those people, like me, will end up in surgery or hospitals. But the good news is that the majority of people can end up relieving their back pain with what I'm going to be sharing with you today and throughout this pain management series leading into our free ab rehab challenge. We're going to be able to be taking small steps over the course of the next few weeks to feeling stronger and more stable and more confident, just better in your body. So today I'm going to be bringing you some high value coaching here on our Wellness Wednesday to identify the kind of what I call the domino effect of poor posture. And then I also want to go into kind of the 4 most common causes of poor posture for moms and help you identify maybe where you are and give you some simple fixes for those everyday posture and activities that you want to improve. If you missed last week, part 1, where I introduced you to the 3-part framework that we are following, I've got that linked in our description. I want you to be able to review that. But today, like I said, we're going to really focus on posture, which is the first component of the framework. But first, let me introduce myself for any of our new members joining us. So if you're here, if you're on live, say hello to me in the comments, give me a little wave. And I'm welcoming you to our Fuse to Fitness Pain Management series. I am Morgan Tabot, your certified prenatal and postpartum fitness specialist. I'm also your certified personal trainer, and I've helped hundreds of moms dealing with back pain and postpartum related symptoms. Me personally, after having multiple spinal surgeries and living with chronic pain, I have definitely had to reevaluate and learn how to kind of rebuild from the bottom up in terms of strength in a very sustainable way. And because of that, because of starting over many times with spine surgeries, I've kind of mastered that beginner's mindset, if you will, when it comes to beginning again. So now what I really hope to do is to help make fitness more accessible and sustainable for you. And I'm so glad that you're with me on this. So first off, I think it's really important for us to point out and recognize that you're not alone. I want you to make sure that you look at the women joining the Ab Rehab Challenge with you, reach out to a friend, bring her into this space where we can really work together to make some significant changes. I think that's really the first place to start, is to know that you are surrounded by people who want to lift you up and support you. And this isn't something that you are stuck with, right? It's not something that you can't change. It's definitely something that we can work on together. So how is your posture? Let's start with this. Last week, I asked about posture in the Ab Rehab Challenge group, and pretty much everybody was saying, I don't have good posture, or I have terrible posture. So what I want you to do right now is to comment on 1 or 2 activities that you do frequently during your day. So what are some things that you're constantly doing every day? Is it driving? Is it working at a desk? Is it, cleaning up, picking up the house? Whatever that thing is. And while you're doing that, I'm going to clarify quickly what posture is, because it's not just sitting up straighter and pulling your shoulders back, okay? Posture is proper joint alignment. I want you to remember this. And that leads to good structural health, okay? And we have around 350 joints in our body. Joints are where 2 or more bones come together and connect. And these joints are designed to do up to 4 different things, right? Some of these joints hinge, like an elbow or a knee, where it's just an open and shut in one motion. Some joints rotate, like your hip in a ball and socket. Some joints glide. So think about how your shoulder blades can glide in and out and also up and down. And then some joints are meant to stabilize. So think of your sacroiliac joint, your SI joint, where your pelvis meets your sacrum, or your lumbar joints. These aren't really meant to be mobile, okay? They're meant to stabilize. Lydia, Laura, so glad you guys are jumping in. So in the comments, what are some daily activities that you are doing on a regular basis? Because daily activities play a huge role in your structural health, your lifestyle, right? And for most people, their daily activities involve a lot of sitting. Sitting is like the new smoking. And at home, in the office, in the car, wherever you are, we're sitting for 10 or 12 hours a day. And this creates two massive problems that I want to identify for you right now. And the first one being loss of strength or muscle atrophy, okay? And I'm talking about core strength primarily, and I'm sure you've heard the phrase, use it or lose it. And this is really true when it comes to your muscle strength. Muscle is a metabolic hog, if you will, which basically means it uses a lot of resources. And if you are not actively using your core strength, it disappears in a matter of days, weeks. It doesn't take long. Why? Because it's using so many resources. Your brain and your body want to be as efficient as possible, and they want to reduce, and conserve energy. And so it's like, we're not using this, so we'll just shut it off. Okay. And that's really how that muscle atrophy starts to break down as soon as you stop using it, which can feel kind of shocking, right? And then the second thing is loss of mobility. When you start to lose flexibility, so like when you are always in the same position or you're not moving your body in certain ways, you start to create muscle imbalances, right? Your body becomes too comfortable, for example, in a seated or a relaxed position. But then as soon as you try to do something dynamic, go for a walk, a run, or work out, or do any cleaning around, pushing the vacuum around the house, anything like that, anything dynamic, you can feel weakness, you can feel pain, stiffness, and just overall a lesser quality of life. And maybe even like you're not aging well, right? And these are things we want to avoid, and we can reverse and avoid. But all three of these things combined, when we're talking about poor posture, loss of mobility, and lack of strength, is it ends up being like this perfect storm for possible injury and increased acute or chronic pain. And to make matters worse, it's like usually we start noticing the effects of this. We start feeling uncomfortable in our body, or in our day-to-day, we start noticing we're not doing the same types of activities or enjoying, things because it doesn't feel good. Our body doesn't feel good. So then when you start to attempt to do something simple, around the house, whatever, you end up saying things like, but I was only, fill in the blank, or, well, all I did was X, Y, and Z, fill in the blank. For example, I had a client that came to me because all she did was push her daughter on the swing, and then she felt her back seize up, and she was miserable for months after that. I also had a client say, all I did was carry the groceries in, and then I had this shooting pain from my low back down into my leg. So have you ever experienced something like this? What was it for you, right? What was that situation? If you could tell me, Coach, all I did was, and I want you to fill in the blank, right? Maybe it was lifting the turkey out of the oven for Thanksgiving, and then your back kind of, was talking to you. And here's the thing about pain. Pain is your body's way of communicating with you that something isn't right, right? And the longer you put it off, and the longer you kind of, brush it off, ignoring that pain, ignoring that communication, the more it's going to compound and the worse it's going to get. And it's like this. It's like, if you're feeling uncomfortable about doing something, maybe you don't run anymore because it's painful, or you don't do squats anymore because it hurts your knees, or you don't do X, Y, and Z, right? The more we restrict our bodies from movement, the worse it becomes for us to return to movement, the harder it becomes for us to return to movement. And the more that we neglect and ignore the communication that our body's trying to send us with pain and discomfort and stiffness, that's your body trying to tell you, you know what, this is not an ideal situation for me. I mean, I'm making it work, but I wish that we would do something different because this is uncomfortable. And you're saying things like, I know, but I just don't have time to deal with that right now. Or it's actually really inconvenient for me to try and figure out what's going on. Or, well, I've tried getting rid of this pain. I've tried working on it, but nothing works. Right. And this is just again, that perfect storm, that recipe for for more pain, for injury. So what are you supposed to do? So maybe you do need to stretch your back out. It's super tight after that incident. So you want to get more flexible. You start stretching daily, or maybe you go to yoga and the yoga teacher shows you some different poses to help stretch you out and get you some more flexibility. And you're noticing some of that improvement, but you still have weakness, and there's still something causing pain in other ways, in other aspects of your life. So you think, okay, maybe I need to do something different. So then you go to a personal trainer, you get to the gym, and they're trying to help you focus on strength training, and they're trying to help you fix it with exercise and weightlifting. And you're noticing, some strength gains, right? But you still have these stiffness and these aches, or maybe you've stopped being consistent with your yogas. You're going to the gym now, but either way, you're still feeling like something's off, and the stiffness and the pain are still kind of hanging around, right? So at this point, you're like, gosh, you've spoken with your doctor, and maybe they've prescribed you some physical therapy. So you go to see the physical therapist who gives you some posture correcting movements or some balance exercises to start working on. But it's just like, when does it end, right? When does all this start to click? And when do you get to start feeling better? And who's right? Right? What am I supposed to be doing? The yoga, the strength, the posture stuff? The answer is all of these are right. You need that framework that we've talked about: posture, mobility, and strength. And the trick is here's the thing, that single isolated event, like Lydia says, my husband stood up from the couch and put his back out. All I did was get up off the couch. And now I can't get off the couch because my back hurts so much. Right? Here's the thing, that single isolated event, getting up off the couch, that was just the straw that broke the camel's back. Nothing works in isolation, right? So that one event was actually the accumulation of lots of small things that you have done or didn't do day in and day out that have compounded over time. And this is your body just saying, I've had enough, we're done. And this is exactly how we are going to approach reversing all of this through a very small series of steps that will compound over time, but in a positive way, to start reversing what you haven't been doing, right? We're not going to tackle everything all at once, right? The all or nothing approach is not a sustainable approach to wellness. And the other point to this, when we're talking about nothing working in isolation, this is why we do need the entire framework to be successful. You cannot skip out on mobility and just focus on lifting weights and, being more mindful of your posture during the day. Or you can't just lift weights and hit the gym and take a yoga class once a week, but neglect your posture. All of these things have to work together. And this, in the last 23 years of constantly going through this again and again and again for my own self, after every spinal surgery, after every injury, after all the recovery time, seeing, so many different professionals, this is what I've put together. It's like each professional has their own niche in how they approach supporting you and your pain and your rehabilitation, but none of them are working together, right? So I'm pulling all of that together for you. And our posture is going to be the foundation of your home. Your home is your body. So if anybody here has built a house, or I'm sure you live in a house, we need that foundation to be level, to be square, and to be structurally sound, right? Before we can start adding on anything else. So step one is to build awareness around your daily posture and alignment, and start to create a foundation for us, you and I, to work together so that you can have better access to the mobility work and the strength work that you want to do. Okay. So let me ask you, how many of you are working out regularly, but you're still noticing that you have pain, stiffness, weakness, or lack of flexibility, et cetera? I remember in the first session last week, Megan mentioned this. She was talking about how she was working out regularly, but she still has this pain that she's dealing with. If you don't have that posture foundation in place, you cannot get proper strength or access to proper mobility. And you actually end up wasting your efforts or making things worse. Okay. And I'm gonna help you through this right now. And I want to share the 4 most common causes of poor posture that are going to lead to this structural breakdown, where even if you're working out and doing yoga or whatever, if these things are happening, the workouts, the mobility, it's not going to be as effective. Okay. As I go through these 4 things, I want you to comment below, even if you're catching the replay, comment and let me know which ones you need to work on. What are you aware of right now? So it might be a combination of things. It might just be one thing, but let's build the awareness together. And the first one is sitting for too long and too often. In fact, being in one position for too long can make your body just like we said, structurally fall apart, crumble and fall apart. Even if you have your desk set up for ideal ergonomics, and if you're not sure what that is, ask me in the comments. Being in one position for too long is not healthy. So here's what I want you to do. I told you I'm going to give you simple fixes that you can start working on it. If you're identifying, if you're aware that you are sitting for too long or too often, you're in a single position too long, too often, I want you to set a timer for 30 minutes. And here's what I just want you to get up and walk around the room and then get right back to work. And you're like, yeah, I've heard that before. It doesn't work. No, listen to what I'm asking you. You'll find that changing positions is going to make a positive impact. But notice, I didn't say you needed to go for a mile walk or do anything time intensive or physically demanding. Get up, walk around the room, change position frequently. No exercises to remember, no workout that you have to do, just change positions. If you start doing that, I'll bet you'll notice a positive improvement this week. In fact, if you do it today for the rest of the day, I'll bet you'll notice a difference. Lydia, excellent. Sitting is definitely one for me. She said, so she's identifying this, you're becoming aware, carpools, traveling, working at a desk. So Lydia, that's a challenge right there that you can take on this week and commit to saying, I'm going to make sure I'm changing positions, right? That's the first one. The second one is standing or sitting with one hip or your shoulders out to one side. This could happen crossing your legs while seated. This could happen while carrying anything with the load not being centered. Easiest one to go to is when you're carrying your kid on your hip and you kind of stick your hip out so they can sit on it. This is terrible, right? We want to practice standing with equal pressure on both feet or sitting with equal pressure on both of your sit bones. And that's exactly where you need to go to. If you notice that this is something that you can pick out and be aware of in your daily activity, if you're constantly carrying things off balance, right? Get equal pressure on both feet or sit equally on both your sit bones. And one of the things that can help you find that neutral from a sitting position is doing pelvic tilts. So tucking under, tucking back, right? So that's the second one. The third one is that you're pinching your shoulder blades back. If I'm like talking about posture and you're like, all of a sudden you're straightening up and you're like pulling those shoulders back, try it right now. Pull your shoulder blades back nice and tight, right? And you're thinking, okay, this is really good posture. What's actually happening when you squeeze your shoulder blades back? Your ribs start to flare up. Your low back starts to arch. You get that flexion in your low back, which equals low back pain. The other thing that's happening as you do this, when you arch up like this, pull those shoulders back, all of these core muscles become stretched. And when they are stretched and extended for too long, they become weak. They turn off. So they're going into that atrophy that we've already talked about. So what I want you to do is focus on finding this neutral in your shoulders. Don't roll them and squeeze them back. Let them come up and settle down in line with your spine. Take a photo, all right? This is your action step. Take a photo from the side and get an idea of what your neutral posture is like right now. And if you want feedback on that, post it, tag me in the group. You could also do this when you get down on your hands and knees and sort of the classic yoga stretch, cat-cow. Do a couple of cat-cows. Watch yourself in a mirror or videotape yourself and then finding neutral. Find a sense of what that is for you. The other thing is, for a lot of women, stress is carried up here in our neck and shoulders, and we're constantly like stressing out, anxious, doing all the things with our families. And this is going to affect how you breathe. Okay. And what causes is when you're constantly stressed, you're not taking full breaths and you're always breathing up here into your chest, which causes the ribs to flare as well, which again creates that low back pain and also puts unnecessary pressure on your pelvic floor. So learning how to breathe properly is another main tool to help you improve your posture. And breath breath work is one of the things that I'm going to coach you on inside the Ab Rehab Challenge. So make sure you're signed up for that. The fourth one, tight muscles. Okay. So we've said sitting for too long and too often, not changing positions, standing or sitting with one hip popped out to the side. We want that. We want to correct that. Pinching shoulder blades back, right? And then tight muscles. Tight muscles pull you out of alignment. And this can end up becoming like your new normal because your body will always take the path of least resistance in any situation. So if you're constantly tense and you're constantly out of alignment, your body's going to adjust to meet you there. I want you to imagine wearing a loaded backpack, a heavy backpack, or carrying a baby in a pack, right? And you've got all the straps on one side pulled super tight, but the opposite side is totally loose, right? That's what's happening inside your body when your alignment is off. It's pulling all those muscles to one side and everything else over here isn't being used properly. And so again, we're creating that atrophy. It's pulling everything out of good alignment. And it's also overworking and overloading some muscles. So in the comments, which of these or combination of these are you aware of right now? 1, 2, 3, and 4. You've got to start with your posture awareness. So I want you to start to pay attention to these today, this week. And I want you to try some of the suggestions that I just mentioned. And if you are committed, right? If you are committed to trying one of these suggestions that I just gave you, then I want you to comment, I'm taking action. You know, the thing is, information is not going to get you results. Action leads to transformation. You have to actually do something. Okay. And everything that we talked about should feel accessible, not like a huge time commitment, nothing you have to really work hard at. These should all be really simple, approachable things that you could be doing anytime. So I want you to commit to putting this stuff into play throughout the week and checking back in as you go through things, as you notice these things that are happening. If you need to unpack something more, bring it up and tag me. Let's talk through this. Because my whole point with this series, right, is to teach you not just what your body needs to feel really good for years to come. You know, I don't want you always feeling like you have to joke about these aches and pains because you're getting older. We can do better, right? We can do better. And posture's our first step. If we can work on this foundation piece, you're going to be moving and feeling freaking great for a long time. All right. So pay attention to your posture as you move throughout the day. And this week, try to make some of these micro corrections, right, in the areas you've identified. Lydia, awesome. 1, 2, and 4. So you know this. You can write it down, give yourself a sticky note if you need to. Micro corrections is the key. So, you know, Lydia, if your week's going crazy and it feels like you can't focus on all of these things at once, focus on number 1, that changing positions, right? Sitting, you know, in the carpools, moving, traveling at your desk, all that stuff that you do. How can you just take that 1 second, to just stand up and, you know, quickly stretch, do a quick little march with your legs, and then you sit back down and you're back at the desk working. That's what I'm talking about when I talk about micro correction. Okay. Make sure that you come back next week, Wednesday at noon, right here. We're going to be diving into mobility. Same thing. I'm going to help you build the awareness, and I'm going to give you these micro corrections to start working towards it. We're doing this piece by piece as we build up towards the Ab Rehab Challenge, which you've got to get signed up for. The link is above in the description. And invite a friend, share about the challenge, bring them along this journey with you for a little bit of fun, right? If you are signed up and you're inside the Ab Rehab Challenge group right now, I'm actually going to be doing a giveaway next week. So I want to make sure that you're signed up, that you can win a set of resistance loops. I love these. And I want to show you how to incorporate these in this process to help with strengthening, to help with stretching, and to help with mobility. We can do a lot with these, and I want to be able to gift these to a couple of moms. So hopefully that's encouragement for you to get into that group, get signed up for the challenge, bring a mom friend along with you. We are always better together. Ladies, health is a daily practice, okay? So commit, don't quit, and meet me back here next Wednesday. I'm always there for you in the group if you've got questions along the way. Right? See ya.